But I can't just say that it's up to young people to do this. I think if we're going to rely on our young people, then we need to think about how do we have more intergenerational approaches being played out so that young folks can share what they know with older folks who can share what they know so that the younger folks can not have to start from square one in order to make a difference and a change.
Welcome to The Measure. I am your host, Leon Andrews, President and CEO of Equal Measure. At Equal Measure, we partner with foundations, nonprofits, and public institutions to advance social justice through learning, measurement, evaluation, and strategy. On the podcast, we talk with leaders and practitioners about centering racial equity and transforming systems. Today, I am honored to speak with Dr. Dwayne Proctor. Dwayne is the president and CEO of Missouri Foundation for Health. He has more than 20 years of experience in philanthropy, including his time at the Robert Wood Johnson Foundation. And I'm also proud to be able to call him a good friend. Welcome, Dwayne.
Hey, thank you, Leon. I appreciate being here.
And I want to kind of start there for our audience to really get a sense of you and who you are. We tend to ask our guests about their background because we very much believe that place and context matters as we think about who people are, how you show up, and how it shapes who you are. So I'd love for you to share with our audience how you think about place, how you think about context in your journey, and how it shaped kind of how you would say who you are today.
I'm from Washington, D.C. Proud Washingtonian, bred in the DMV. My family comes from Washington, D.C., so we've been there for a few generations. And it just made for a great way to grow up because I was surrounded. I couldn't get away with anything. Okay. I mean, like there are people everywhere. I still do this when I'm in DC. I bump into cousins and I'm like, oh, and that's a part of the thrill of coming home when I do so. My grandfather in DC, I forgot to mention, he was a Pullman porter.
Mm.
And it's really important to point this out because Pullman porters were they wrote the blueprint for the civil rights movement. Even before everything kicked off, gaining rights for themselves in their work. So social justice, standing up for rights, knowing our politics. I always say that DC is full of get up, stand up people.
Yeah, I love that story, Dwayne. But you also have a fascinating storyline when I first met you many years ago about your journey with Ray Charles. So
Yeah.
I can't let the audience not know about how you talk about how that was also part of your narrative. So talk about the time you were working with and hanging out with Ray Charles.
So it still starts in DC. So I think when I was 14, I decided I wanted to be a disc jockey. And of course, I decided I wanted to be the world's greatest disc jockey. And so I got involved in radio and radio broadcasting. I went to Virginia Tech to study communications. And 2 years later, I went to my advisor and I asked my advisor, I said, I think I'm done. I think I'm ready to graduate. I've taken all your classes and, I need to get back to DC and get back in the market. And they explained to me that I needed to have a minor. And so when I came back for my third year, it was after my mom had married and my Pell Grants were gone.
Mm,
So I was out of school.
mm,
I was a college dropout for, reasons of finances, not academics. I had a job at a country and western radio station. I was a DJ in a nightclub. I cooked at a restaurant. All three jobs, all to make money to try to go back to school. I happened to be cleaning records at the disco one night, one afternoon, and Ray Charles's band members walked in, four of them,
mm,
and we hung out. And then eventually the road manager said he invited me to go on the road with them to be the sound mixer and the announcer for the concerts. And we went around the world a couple of times. I was on two world tours. And Ray Charles one night told me, he says, you know what, you really should go back to school. And so when Ray Charles gives you advice, you take it.
mm,
Eventually, I applied to school at University of Connecticut, and every year I would see Ray Charles in a band because the tours are cyclical, and they always came to where I was. So I was
mm,
always able to go back and get a dose of wisdom. And I was happy that I did get a chance to share with him that I got my PhD before he died,
Mm,
and he and I had a long talk about that. And it was just it was a beautiful moment.
mm.
It was like a full circle moment, and I always say that Ray Charles was the uncle that my father never knew I had. Yeah, no, thanks for asking. It's a
Yeah.
great part of my background.
No, I thank you for sharing that, Dwayne, and I love that part of your story because even as I got to know you, you were at the Robert Johnson Foundation.
Yeah,
I was just starting at the National League of Cities, and RWJF had just made this huge investment in reversing was it combating or reversing childhood obesity by 2016. I think it
yeah.
was the and investing a $500 million. And 4 years ago, you left RWJF to join the Missouri Foundation for Health and to become their president and CEO. And so went from this massive national initiative to then be very targeted regionally.
It's been good, but it was quite a leap. I'm going to say, at least for me, I sat at the feet of Angela Glover Blackwell at PolicyLink,
Mm-hmm,
and others who helped me understand the value of equity. You know, equality is a great American ideal. It's a value that we hold dear, yet it had not been serving most of the people in the same way, and that's where equity came in. And
mm-hmm,
so even as we were working on childhood obesity prevention, I was learning about equity. And so then coming to Missouri Foundation for Health and being able to say to their board, I think we can achieve health equity here in 10 years. And I heard some gasp. I heard a couple of giggles, and they were like, "What are you talking about?" I said, "Well, health equity is not health equality. I mean, we want to make certain that Missourians have a fair and just opportunity to be healthy. And that means making certain to address the barriers that may systemic barriers like discrimination. Okay, whether it is racial discrimination or discrimination against people with disabilities or discrimination against poor people, we need to understand that better and remove those barriers so that so the systems work better for everyone. So I was able to take that knowledge from RWJF and bring it in and make that bold and audacious statement. And I still believe it's true. It may take a little bit more than 10 years, but I still believe it's true because what I really meant was how do we engage with communities in a way that we understand that we can learn from community wisdom. If we went into a community and this happened and we said we want to address the abysmal maternal and child health outcomes in Missouri, then we have to do so with communities. And as we went into some of the hardest hit communities, because that's the other thing I learned during childhood obesity is you have to work where the struggle is the greatest.
mm,
You have to work where the challenge is the greatest, because if you can make a difference in those areas, you can make a difference everywhere. And in the case of working on issues of Black women and babies, 30% of the children, the Black babies who were not surviving their first year of life in Missouri, 30% were in St. Louis in this area we call, excuse me, the Boot Heel. And
mm,
the Boot Heel is a southeast corner. It's a little peninsula, so to speak. It's surrounded by Tennessee, Kentucky, and Arkansas. And so it's a very poor area and an area where they're still dealing with a lot of different social traumas. And my staff told me that when they first went in there and said we want to work on infant and child mortality work, the community said that's great, but it has to start with housing
mm,
and making certain that we have adequate housing, affordable, adequate housing, that we can bring our babies home to an environment that was safe for them to be raised in. And so we followed the lead of communities and
mm,
started working on housing issues. And then that helped build trust between our work and the communities. And we just let the community lead us along. And right now, anecdotally speaking, many of those babies in the area are doing much better than statistics would allow for their survival. They're
mm,
living past the first year of their lives.
mm,
There's much more work to be done, of course, but that's the equity approach. And we now know that some of the things that we learned working in St. Louis and working on the Boot Hill in that area we can use those approaches to work with other communities. Doesn't mean we can take what we learned in Boot Hill and put it in Springfield or Joplin or Columbia. No, we can take the approaches of how we worked with communities, what lessons we learned in that way
Mhm.
to in order to make the changes that we needed to see. Identifying leaders is one aspect of achieving health equity in a 10-year period of time. The other is identifying innovations and homegrown innovations that are suited for these communities that are here.
I love that, Dwayne. But are there some wins or of examples of where you're seeing some of the innovation or seeing some of the progress?
Yeah, the wins are they're oddly obscured
Hmm.
in ways. But we do have big wins. You know, when I started in philanthropy, we were just getting used to the idea that foundations that create something used to be that states would pick it up. Right,
Mm.
states would pick it up, and then that's how things would roll out. In the early 2000s, states weren't doing that anymore, and foundations then shifted towards, well, we need to do systems changes, and we need to do systems changes, which really means you need to change policies and practices in order for them to work better and work better for everyone. And so that was a great era to be in philanthropy. We're still in that era, but I'm in this very interesting state of Missouri. Okay, and I say interesting with all due respect. It's complex, it's challenging. I'm an outsider, so I come into everything with fresh eyes. But the wins that are obscured. So when I arrived, and this is the work of advocates and others before I was even here, right? Have been working and pushing to get Medicaid expansion as a part of the Missouri landscape. There was a referendum held, and the referendum was to have Medicaid expansion attached to the Missouri Constitution. The referendum passed, and passed by a lot of votes. And I think 30% of the votes came from the rural communities,
Mm.
and all other supportive votes came from Kansas City and St. Louis areas. And I'm generalizing, but
Yeah.
those are the areas that have more of Black and brown populations than you might see scattered across the rural areas here in Missouri. And the legislators were not interested in supporting the will of the people in that way. And they had their reasons for it. The governor also had his reasons for not being interested in supporting it. And so our foundation, along with other foundations here in Missouri, we provided dollars so that plaintiffs who were going to be unduly affected by their inactions could take this to court. And they did. They took it to court, and the courts agreed. The court said that this was a constitutional issue, and so they did not. They were not supportive of the suit moving forward as it did. But being a constitutional issue, it went to the Missouri Supreme Court, and Missouri Supreme Court ruled in favor of the people, and 350,000 Missourians were eligible to sign up for Medicaid after that happened, and 350,000 Missourians did
That's
sign up
great.
for
That's great.
Medicaid. So that was a win.
Yeah.
And but after the public health emergency ended with COVID-19, there became some unwinding of procedural unwindings of people losing their Medicaid.
Mm.
So that's what I mean by the wins get
Mm.
obscured. And you get a win, and then it goes back. And so it's a lot of ping ponging back and forth.
Yeah.
But again, when we fail, we learn,
Mm.
right? We learn, and we focus on the strong relationships and the collaborations that it took to get there.
Well, yeah, it's real, and we are living in interesting times for sure. You know, and you being, as you said, in an interesting state in Missouri, these contentious, climate is very the political climate is what I know you're navigating. The end and with the damaging effects as you're talking about the funding cuts, yeah, and but you have still remained committed to health equity.
When the first announcements came out about federal cuts to nonprofit organizations here, Missouri, last time I checked, we have 40,000 nonprofit organizations in the state, and 19,000 are right here in St. Louis. It was so destabilizing. for the nonprofit networks. Many folks had to let people go, and I'm talking about laying off 65% of their staffs.
Mm.
A lot of nonprofits are looking to, well, we work in the same areas, we work in the same zip codes. Can we combine and become one organization? But you need resources to do that as well.
Mhm.
A lot of folks are, scrubbing their websites and getting off words that were not offensive 10 months ago that are offensive today, like equity, and so it makes it very, very hard out there. Our foundation does not take federal money or state money, like many foundations. So we have an opportunity to live up to our ideals. MFH, we talk about equity as one of our core values. We talk about trust, humility, integrity, and commitment, all as our core values. Our integrity isn't standing up for health equity. It's what we're about. It's who we are. If we were to change without being asked, if we're going to bow to power that has not been directed towards us, then we're not living up to a lot of those core values.
Mhm.
If we say we're committed to the communities that we serve, we're committed to the communities we serve. There's no amount of whitewashing that is going to make us be different than who we are, especially if no one's asked us to.
I've enjoyed this conversation, and I hope our audience has as well. And you reflected as we've been talking about all that you've lived through, all the movements that have come through DC, and the fights that you've been fighting, and then the wins and then the step backs, and the continuing to fight. And so I'd love for the audience to hear from you. It is a question I ask all of my guests. In the midst of doing the good work and making good trouble, what continues to give you hope?
I believe in the young people, and they give me a lot of hope because they will be the innovators of the future. They are the ones who do not necessarily have the baggage of living through a community that went through a riot after assassination of a great leader, right? Many of them will come at these at different perspectives. But I can't just say that it's up to young people to do this. I think if we're going to rely on our young people, then we need to think about how do we have more intergenerational approaches being played out so that young folks can share what they know with older folks who can share what they know so that the younger folks can not have to start from square one in order to make a difference and a change. Because we have a blueprint for the times we're in. Right? We didn't have this. The blueprint we talked about, it was written by the Pullman Porters. It was
Mm.
written during the Civil Rights Movement. We can look to Mandela and the anti-apartheid movement, right? We have blueprints for what it takes to maintain where we are and actually to move forward in ways that we should move forward with dignity and integrity. That's where my hope is.
Oh, I love that. I really love that, Dwayne. And yeah, I really appreciate your time today. Your unwavering commitment to equity and healthy communities are inspiration for all of us to keep pushing for the change that we've been talking about. So thank you. Thank you, my friend.
Good. I appreciate you, brother. I appreciate you a lot.
Thank you, my friend. Take care. Take care. As we close out today's conversation with Dwayne, I'm reflecting on the courage it takes to tell the truth about systems that were never designed with everyone in mind. This work asks more than awareness. It asks for honesty, accountability, and a willingness to act even when it's uncomfortable. Audre Lorde reminds us, it's not our differences that divide us. It is our inability to recognize, accept, and celebrate those differences. Dwayne's insights challenge us to move beyond rhetoric and toward practices that honor difference while building real pathways to equity. Thank you for listening. Until next time, stay curious, stay courageous, and keep working toward the change you want to see.